Hi, this is Dr. Duc Vuong. I'm a world-famous bariatric surgeon and author of 13 books with 2 more on the way. Today, I'm going to teach you about the indications for revisional surgery. What's revisional surgery, Dr. Vuong? Now listen, a lot of people have had weight loss surgery and they think they're done. They think the weight is gone forever. Truth of the matter is not true. There are people having their second, third, fourth, and even 5th weight loss surgeries because, I don't know, they never got it in straight in their head. It's not a magic bullet, right? So some patients need to have more than 1 weight loss surgery. For whatever reason, we're going to talk about those indications. There are medical indications, there are insurance indications, there are different reasons, all right? And then we'll also talk about your insurance coverage, whether or not your insurance will cover it. That will be in my premium private secret academy group, Dr. V Academy group, okay? What are the indications, okay? So first of all, what is a revision? What is it, Dr. V? As I've alluded to, it is your more than the next, or another way to say it is another weight loss surgery procedure. Okay? A revision is another weight loss surgery procedure. And there are indications for it, right? Just because you want one doesn't mean you get it. And so the ones we're going to talk about are complications. All right? And then we're also going to talk about your weight. This is an indication. Weight regain, but also inadequate weight loss. Now, on the previous episode, I did a video discussing your options. So, can you go from a lap band to a sleeve, a lap band to a bypass? Can you re-sleeve? When can you go from a sleeve to a bypass? Can you do anything after a bypass? Can you go from a bypass to a sleeve? I did that on another video. I'll put that in the description. You can find that, link to that video later. Now, you really want to watch that video because it's pretty in depth, and I'm not going to cover or answer questions about, hey, Dr. Vuong, what can I have after I failed my bypass? I've already done that video. Do your homework. Go watch this other video. This one, I'm just going to talk about what are your indications, okay? Now, it surprises me that even in the bariatric community, a lot of patients don't know what a revision is. So just comment real quick if you didn't know what a revision was until you stumbled upon this broadcast or this video. Maybe your doctor never talked about a revision. Maybe you just were so excited about having weight loss surgery you didn't really do that much homework. You did some medical tourism and you went to Mexico for surgery or out of the country for surgery, and they never really talked about it. Well, either way, it was very surprising to me to find out that I tried to use the term revision, and a lot of people didn't understand what it was, and you know that's a shame. That's really sad because this is absolutely true. This is the number 1 fastest growing surgery. So in terms of percentage, it's the fastest growing. We used to rarely do revisions, maybe 1% to 2%. Now of all the weight loss surgeries done were revisions, and now they're almost approaching 20%. I mean, it's pretty crazy, right? So almost 20%. And that's only the ones that are reported. Now, there are probably a lot of people who are having revisions where they're not even reported. So you got to think about that. Now, why am I talking about this? It's because in Dr. V's crazy mind, I don't think like there should ever be a revision surgery for weight regain, right? That's avoidable. Not that you don't do it for that, but in my perfect world, in a perfect world, this should be avoidable. Y'all agree? So let's start off. Now that we know what a revision is, let's start off with the first one, complication. You guys ready for the first indication for revision surgery, number one indication is a complication. And I'm going to explain this here in a little bit, okay? And again, I want to reiterate, I'm not judging. If you've had to have a second surgery or third surgery, I'm not making fun of you. Don't feel bad. We've come a long way in the bariatric community in terms of trying to understand what patients really need, especially the support, emotional support, mental side of it. And we're starting to understand that weight loss surgery is not a magic bullet and all be all. So don't feel bad if you've had to have a weight loss revision, or if you're thinking about a revision, right? I just want you to really go into the decision-making process really knowledgeable. Cool? That sound good? All right. So complication. Now this falls into two categories. All right. One is immediate. So like right after surgery, I'm talking 1 to 2 months, you have a complication. And then long term. So you might have some complications long term too. Okay. Now we're starting to see the long term stuff happen. The immediate complications, we know about those, right? So let me give you a few of them. So immediate complication might be a sleeve leak. Now there are some people who get a sleeve leak, and for whatever reason, their surgeon will take them back. We'll take them back to the operating room and do a gastric bypass. They do that. It's a possibility. But let me ask you this question. Did your surgeon, when you were signing up for the sleeve, tell you that you could have a complication and you would wake up with a bypass? Right? You could have something for bleeding. That's kind of rare. There's some band stuff. Where you have to take them back. It's really still considered in that same window. By insurance standards, it's the same surgery. And so it will not be reimbursed. So this will be lost expense to the hospital. Now, I'm happy to say when I was at my last program, I was there for 5 years and never took anyone back to the operating room for a complication. I mean, knock on wood. I mean, I was very blessed. It's not because I was a very good surgeon, but it was about the preparation I did with my patients. All the preoperative work, I did a lot, extensive. They came to classes every week. I saw them twice while they're in the hospital. They came back to group 2 times a week. You know, I had sessions up to 3 times a week, and they had to come to at least one of them every single week, so I could see them, keep an eye on them, check on them. I could catch if they're having trouble drinking, or they're hurting more than they should, or they just wanted to show me their incision or the bruise. I could catch it really early. Now that's my own crazy, obnoxious, obsessive program I created, and I get it. Most surgeons don't do that, and you got the program you got. That's okay. I'm not judging. So that was just something I'm real proud of. 5 years, never took anybody back for the operating room application, right? And you can also get leaks during a bypass too. So a lot of people are like, at least I don't have a sleeve leak. Oh, you can get leaks in bypasses, right? Now the longer term complications are starting to show up. And by longer term, I mean probably more than 2 years. Usually 2 to 5 years. Now why 5 years? Why not longer after that? After that, a lot of people are lost to follow-up. By that, we can't track them. They moved, they lost their insurance, their surgeon retired, their surgeon moved. Their reporting data gets really hard after 5 years. So within 2 to 5 years, okay, it's long-term complications. Now, what are some of these complications that we're going to talk about? All right. Let me get these complications down real quick. Well, and these are approximate. Don't hold me to it, because you could have something like within a year, right? All right. So for the most part, when we're talking about complications, well, let me get this. most part, when we're talking about complications, we're really talking about longer term complications. And I want to break this down into the different surgeries, right? So for those, if you're watching, you have a band, all right? A very common complication was like a slippage. A band would slip. That's it. And the surgeon we used to try to save the band, pull down the stomach, reattach it, blah, blah, blah. Now most people will suggest revising, right? Now here's another terrible complication from a band. It's an erosion. So that means it eats through the stomach. I hate the word eats because it makes people think like, oh my God, the band is eating through my stomach. No, it causes a hole into the stomach. It's kind of like, have you ever heard of a pressure sore? Like if you stay, like nursing homes, if you stay on your butt too long, you get pressure sores on your butt because your butt is rubbing against the bed sheets. That's the same thing. So a band around the top of the stomach, there's a small chance that it could eventually rub a hole into the stomach, right? It doesn't technically eat the stomach. Some people are worried about that. So an erosion is a complication that we would do. And then, I don't want to say it's funnier, but this is probably the most common. I would call it intolerance. By that, I really mean that the band is too tight. Now, if you're a band person watching, you probably can comment and confirm what I'm trying to tell you here. Like intolerance, like you have trouble drinking water, certain foods get stuck a lot or all the time. You get to a point where you're having trouble just eating any real food. You start falling into slider food, stuff like that, right? That's very common, and that leads to weight regain. We're going to talk about weight regain as a different reason, but right now we're just talking about complications, right? And then also you could have something with your port. Your port could malfunction. It could leak, that sort of stuff. And those would be reasons why you want to either remove the band or revise to a different surgery. Okay? Also esophagus damage. So esophagus. So some band patients, their esophagus will get massively dilated if they haven't had follow-up, and their band has been too tight. Then their esophagus above the band will actually dilate out and stretch. And those are the days when people feel like they can eat all they want, but it doesn't actually go down. It just sits in their esophagus. And then they'll regurgitate it up 2 or 3 days later. I know that sounds awful, but that can happen with the band. So another reason why the band's not so popular anymore. So now with the sleeve, again, we're talking longer term complications. Probably the worst one, I would say, is a non-healing leak. Now that we're getting more comfortable with the sleeve and we're starting to understand the process of what causes a leak, most leaks you can heal. Luckily, I've only had one leak in my career, and she's doing fine. But so non-healing leaks, sometimes like they end up having a connection to the skin or connection up into your lungs, that sort of stuff. It gets pretty complicated, in which case your surgeon's got to do a good job of fighting with your insurance to cover this non-healing leak. All right. Another one, this is probably the most common one, is I'll put a star by this one. It's intractable heartburn. This is just heartburn that's so bad that, boy, you're taking 3 different types of antacids. You're eating properly. You've cut out all the acid foods. You've done everything. I have that heartburn video. Tells you what to do. You've done all that stuff. You cut out the coffee. You cut out the alcohol. You cut out the pasta sauces, and you're on your medicines 3 times a day, and you still have terrible heartburn, right? And this might or might not be related with a hiatal hernia, plus minus, right? And but you just can't take it anymore. Nothing seems to control it. I would call that intractable heartburn. If you have controllable heartburn, you're not going to get a revision, not likely. They would just manage you with medicines. But if it's just you tried everything, your surgeon might take you back for a different surgery. Usually a sleeve to a bypass is probably the most common thing. Okay. Another one is difficulty eating due to like a stricture. I wrote stricture. Difficulty eating from something like a stricture, where, boy, you're having real trouble swallowing, food's not passing down, you've had multiple hospitalizations for dehydration, for example. Your doctor has done an x-ray called a barium swallow, which I've talked about before, and they really see that stricture, that tight spot. They're going to want to go down there and do a bypass revision on you. Okay, so what are the long-term complications for a bypass? And when I say bypass, most people mean the Roux-en-Y gastric bypass, right? So a very common one are ulcers. Now this is very hard to fix, okay? So don't assume. This is not like a normal stomach ulcer. Like grandpa had indigestion and had bleeding ulcers and stuff like that. While technically it's the same thing, gastric bypass ulcers are very different beasts. It's caused more by hormonal changes in the anatomy, in the surgery itself, and there might be some issues with bowel reflux, things like that. But this might require another surgery. Mostly, however, it's not for weight. It's not for weight. So I want you guys to separate. Don't look at this as a weight loss surgery at this point. You're trying to fix. This revision surgery is to fix the original bypass, not to give you another surgery. All right? And yes, you can also have heartburn. Some people think that a bypass will fix heartburn or you won't get heartburn after a bypass. Absolutely not true. Bypass patients can get heartburn. Yes, it's a lower incidence than the sleeve, but still very possible to get heartburn with a bypass. In fact, comment if you have a bypass and you still get heartburn, right? Now, one thing that's getting more common that we see now is nutrition. In fact, I should say malnutrition, which means you're not getting the nutrients you need. So we're starting to see a lot of anemia. I should write that down. So you're not getting enough hemoglobin, anemia, and then vitamin deficiencies. So people are coming up with all sorts of vitamin deficiencies, like vitamin D deficiency, bone diseases, neurological disorders, clumsiness, forgetfulness, ataxia. That's where you're just kind of all over the place, clumsy like that. So sometimes you have to reverse. If this happens, you have to reverse the bypass. Pretty scary stuff, right? Now, the duodenal switch, the DS for short, the switch. Long-term complication with the switch is going to be malnutrition again, because it's a very malabsorptive surgery, malnutrition. And this is usually in terms of fats and other fat-soluble vitamins. That's really bad. A lot of people have to get artificial nutrition called TPN. But a surgeon will go in there and can reverse it. So this is much more common, malnutrition, and also some of the other side effects. So what are the other side effects? Like some patients don't like body odor or diarrhea. Can be really bad. So they can't tolerate the side effects. So they like the weight loss, but they don't like the side effects, okay? So these are some of the long-term complications that might require you to have another weight loss surgery to help or fix. They might or might not be covered by your insurance, and that's something really your surgeon needs to go through with you, okay? And a lot of times they have to fight it on your behalf. Now, I'll be back and we'll talk about weight loss and weight regain as indications for surgery. Okay, so we just talked about the complications, so let's get to what you really want to know. Dr. V, what if I didn't lose enough weight? Dr. V, what if I'm regaining weight? When is the revision? Okay, so we'll talk about that now. Number 2 is inadequate weight loss. So the first thing I want you to do is you have to figure out your BMI. So I'm going to go back to the BMI, and I know the BMI is not perfect. I know the BMI doesn't tell you how much muscle mass you have. BMI doesn't tell you how sexy you are. BMI, I know it's not perfect, okay? But you have to know your BMI because it's for your insurance purposes and how we measure success as surgeons, okay? So what you can do is just go on Google and Google BMI calculator, and it will put in your number, right? So anything, a BMI over, let's just go through it real quick, all right? Normal BMI, anyone know the range? Normal BMI is 19 to 25, all right? Anything over 25, BMI of 25 to 30 is considered overweight. BMI over 30 to 40 is considered obese. And BMI over 40 is considered morbidly obese. All right. So, and then that's going to be really kind of indication for insurance coverage. And a lot of you guys had to do this, and a lot of surgeons won't operate on you unless you have like a BMI of 35 with comorbidities or morbid obesity, BMI over 40, okay? Now, why am I making you do this? Is because just because you didn't lose as much weight as you want, but let's say your BMI is like 30, your insurance is not going to cover a revision. It just won't. That's where you're just going to have to, dude, like get the junk out of the house. You have to follow the Dr. V diet. You got to handle the emotional stuff. You got to handle the anxiety stuff. You got to get off the sleeping pills. You got to get off the narcotics. You got to quit hanging out with your dope smoking fiends. You know, that's it. That's just the truth, right? And most surgeons won't operate on you. So, inadequate weight loss. We think this applies to about 30% of patients who have weight loss surgery. They did not lose enough weight. Up to 30% and maybe even higher. Okay? Now, this is kind of shocking. And by inadequate weight loss, we're hoping for a BMI less than 30. Okay? We want to get you out of the obese category. Because once we get you out of the obese category, BMI less than 30, now this is the role for, I know you don't like this word, but it's true. This is where diet, pills, meal replacements like OptiFast, exercise, which I don't think that's not good for weight loss. But you get the idea. Lifestyle. This is what, if your BMI is currently between 25 and 30, this is where you got to get into that, get clean with your food. Got to maybe try some diet pills, especially regaining medications. And people are just shocked. I don't understand how people don't know. There are certain antidepressants, not all of them, but a lot of them that will cause weight gain. I mean, you know that, right? So, and there is chronic, deep, serious depression. I get that. But most of Americans who are on depression pills, honestly, they just need to wake the fuck up. It's not really helping you. It's causing you more side effects. It's not going to bring your mama back. And I say that with a lot of love. I lost my dad to cancer, right? So, but we all have blue days. We all have days where we don't want to go to work. We all have days where it just feels a little overwhelming. But that's when it's time to adult up, man. It's time to man up or woman up. It's time to pull up your big girl panties, right? This is, hate to say it, but this is the big girl panty part. So if you're in this range, if your BMI is 30, 31, 32, or even this range, it's going to be these two ranges right here. I mean, you got to get more disciplined. You got to watch more Dr. V videos. You got to invest in yourself. You got to get off the couch. You got to hang around better people. You got to do that hard work, right? Inadequate weight loss. But a third of the patients won't get below 30, BMI of 30. So, okay. Now let's talk about weight regain, which is probably what most of y'all want to know about. Weight regain. Oh, this will apply to both of this. I'll cover it here. Just remind me. I want to talk about the wrong surgery. Some people think that they didn't lose enough weight or they're regaining weight because they got the wrong surgery. They should have gotten a bypass when they got a sleeve. I want to tell you, a lot of bypass patients are sitting there watching going, man, I wish they had the sleeve back in the day. When I got the bypass, I wish I'd gotten the sleeve. See, both people want it both ways. It's crazy, right? So let's talk about weight regain. Now, this is weight regain happens about 33% of patients. If your BMI is over 50, there's one study that says you have a 50% failure rate. I hate the term failure, but you get the idea. If your BMI is over 50, you have a 1 in 2 chance of not losing enough weight, inadequate weight loss, or weight regain. Now, my issue with weight regain is this. It's really devastating. It's emotionally devastating, right? Give me some amens. I mean, you went through all this stuff. You went through the insurance approval process. You paid a lot of money out of pocket. You were gung-ho. You were going to get your family on board. It might have cost you your marriage. You might have woke up one day and realized you were married to a fucker, man, and you needed to up your game. And you've changed your whole life. Maybe you bought that gym membership. Maybe you moved away from your, overbearing mom, and now you're starting to regain weight. It's emotionally devastating. And this is not a judgment call, and it's not scientific, but this is what I see from y'all. Now comment if you agree. Just put I agree. When you regain weight, it is emotionally devastating. And that's why the weight regain is hard to lose. A lot of people say, Dr. Vuong, why does it seem like losing the regain weight is harder? It's emotionally devastating. You have tied your identity, oh damn, to this. You have tied your identity. You have told a new story. Oh, I'm a failure. I'm a loser. And it's devastating, right? Not good. Okay? So I want to come back to that in a second. But my point with this is if you're watching and you're regaining weight, don't beat yourself up because a lot of people regain weight. 1 in 3 will regain some weight, right? Some weight. Now listen, somebody watching this video is going to be like, I've lost too much weight. I look too skinny. How do I gain weight, Dr. Vuong? Answer is, shut your pie hole. Enjoy it while it lasts because it won't last like that forever. Apart from having malnutrition or complications. If you're having a complication from surgery and you can't eat, and that's why you're wasting away, that's a different story. If you're just losing a lot of weight because your surgery is working for you, don't bitch and complain. Enjoy that journey. Build up your muscle mass. Eat real clean, and you'll look where you want to look. Okay? But don't be chasing that weight. Now, another thing about this, I want to talk about the surgeries real quick, and then I want to come back to this. I hope you're enjoying this real quick. Let me see. Can I get down here? Okay. So, if you have any of this lap band, Dr. Vuong, can I have a revision? Answer? Absolutely yes. That's why we love lap bands. That's why we put so many lap bands in, because it was considered reversible. You could take the lap band out. There is some scar tissue, but it's not that terribly complicated to go do sleeve, lap band to sleeve. I did lots of lap bands to sleeves. You can do lap band to bypasses, and really any surgery. You can even do a band to a band. I don't recommend a band to band, but there are people who've done a lap band to a lap band revision. You know, that's happened to people before. I don't recommend that. Now, how about a sleeve? Dr. Vuong, if I've lost weight, if I'm regaining weight, can you have a revision? Answer is absolutely yes. That's why we love the sleeve, because it works for most people. For 80% of people, the sleeve is going to work amazingly well. But if you regain some weight, if you didn't get down as far as you should, there are patients who start with a BMI of like 70, and they get down to a BMI 45 with the sleeve. Are they a failure? No. They did exactly what the sleeve was designed to do. Now they can go have a bypass, which is very risky when you're super heavy, or the duodenal switch, which is even more powerful, or a minigastric bypass. So yes, you can have it to any surgery. Again, any surgery. And yes, you can put a band around the sleeve. I don't recommend that shit. Don't be putting a band. If your surgeon offers you to put a band around your sleeve because the data looks promising, tell them no. Just say no thank you. You can actually re-sleeve. I had that question posted the other day. Dr. Vuong, can I re-sleeve? I don't want to bypass, but I feel like I just need a little bit more restriction. I've done videos on that. Yes, you can re-sleeve, but you will always fail every single surgery if you keep chasing restriction. Check out my video on that, the common pitfalls, mistakes that patients make, okay? And then now, here comes the bad news. The Roux-en-Y gastric bypass. Is there a revision? Not for weight loss. There's not a good surgery after you've had a bypass to help you with weight regain. Yes, there are a few papers where they've put a lap band around the pouch of a bypass, but those for for a $15,000 surgery, that averages to about 10 pounds of weight loss. That's it. If you've had a bypass and your surgeon says, hey, let's put a lap band around your pouch, make it smaller, that'll get you about 10 more pounds. And most of your insurances won't cover it. And even if they did cover it, that means the rest of us in society are paying for it. That's going to equal 10 pounds of weight loss for you. Think about that. Right? Not super good. You could buy a lot of fruits and vegetables. And you have to remember, if you try to do a DS, because they're, Dr. Vuong, let's get the most powerful surgery, the duodenal switch. This is very complicated, high complication rates. You have to be ready to deal. Do not go into this surgery with your eyes closed. Like, no, I'm going to put it in God's hands. I got my prayer circle. Listen, I believe in prayer, but you cannot do this surgery just with your eyes closed. Trust me. Do not go into that surgery. It's a major surgery. Yes, it's possible, but very complicated, all right? So most of this is going to be for complications. Now, what about DS? Dr. Vuong, that's why I had a DS. Not for weight loss. There really is not much you can do. Surgeon can try to do stuff with your limb lengths and mess it around. Again, high complication rate, not great for weight loss. Most of these are reversed for complications. Okay, not sure if y'all can see that, but most of this is going to be for complications, right? Okay, so I want to get back to this other thing real quick. All right, was that helpful? I'll be right back. Now, this last topic is super important, and I want you to really pay attention to what I'm about to say. Dr. Vuong, I had the wrong surgery. My surgeon screwed up my surgery. You know how often I hear that? Maybe he did, or more likely, maybe you just had a complication, you weren't expecting it, etc. Right? Or maybe he didn't do a good job of explaining what the surgery was going to be. Or maybe most often though, people who have a sleeve often say, I wish, what? I had a bypass. A lot of patients who have a bypass say, I wish they had a sleeve back then. Back in the day, I would have done a sleeve instead. I get this question all the time. Can you revise a bypass to a sleeve, Dr. Vuong? Answer is not for weight loss. Okay? So we're talking about weight loss here, because that's really what you guys are most likely interested in, is having another weight loss surgery to keep losing weight or loss and weight regain. Now, here's the point of this section. If you keep this mindset, you will fail your next surgery. If you continue chasing this mindset, you will fail your next surgery eventually. Right? Eventually. Because the truth of the matter is, you're looking for an answer outside of you, when all along, the answer's always been inside of you. By that I mean, everything that's going to make you successful in this life, whether it's weight loss, health, money, marriage, everything that's going to ever make you successful, it's inside of you. It starts inside of you. It starts with your thoughts, your emotions. And if you're not willing to do the hard work, if you're still blaming your surgeon for retiring, or that you lost your insurance and that's why you regained the weight, you're going to fucking fail the next surgery. You got to stop blaming the system, the country you live in, your surgeon, your program, and you got to start having that deep talk with that person in the mirror. So, why is there junk food in my house? Why are my kids obese? Why am I in this loveless, passionateless marriage? Why don't I have more money? Why don't I move? Why do I keep putting up with my mother-in-law talking bad about me? Why is this person still my friend? Why haven't I figured this out yet? You got to start having that conversation with that person in the mirror. Because that revision surgery, every surgery that you do has more and more risk of complications. Why? Because there's more and more scar tissue. It's a much harder and harder surgery, right? And eventually you run out of options. There's not an infinite number of surgeries for you. Eventually the doctors, the surgeons will pass. We have the right to pass on you. And it could be because your surgery, your case is beyond my skill level, so I'm going to send you to the academic center. Or it could be that you're just a pain in the ass. We're just not going to deal with you. It's not like, yes, everybody's entitled to good health care. But you're not entitled to be a dick. You're not entitled to be whiny jerk and blame. That is a major issue we're having in healthcare right now. It's a lot of and I'm saying this with a lot of love because it's a two-way street. Yes, it's an interaction. It's a relationship. It's not just the doctor. It's you too, right? We have too many people that are burnt out. Too many doctors that are unhealthy, unhappy, stressed out, overweight, not making enough money, worried about their kids, haven't had a vacation in a long time. And on top of that, we've got a system that's broken, right? So we've got long wait hours in the emergency room. We got people misusing the services. And then when you get the services, I'll just be frank about it. We have patients that are just assholes. They're just not grateful. And for whatever reason, maybe because we let them down psychologically. We need to work more and deal better with psychological illnesses, right? We need to have a serious discussion about the narcotic issue in this country and in the world. And when someone's addicted to narcotics, I can't be angry at them because they're not themselves, right? That's why we forgive drug addicts and alcoholics and all that sort of stuff. But at the end of the day, you need to do the hard work. That's where this comes from. There is no wrong surgery per se. It's more of a wrong mindset. Your expectations is what got you in trouble. I thought, Dr. Vuong, I'd have this surgery, and I researched my surgeon, and he came highly recommended, and I just thought I'd have this surgery, and the weight would just vanish, would just come off. I thought if I got that stupid crap band out and got a sleeve that this heartburn would go away, but it's worse than ever. I thought if I had the sleeve and I changed it to a bypass, I would lose my weight regain, and I haven't lost anything. I get these comments all the time. And the only response for you is this. I mean, it's all the hard work in here. And remember, my promise to you has always been this. I never tell you to do something I don't do. I struggle every single day with my own health, my physical fitness, waking up early, eating right, having the right fortitude, mindset, leadership skills. I try to read a book a week. I listen to 10 self-help videos on YouTube at least every single day. I try to cut out the junk, the extra times. I try to only associate with the best people. I try to up-level my circle. It's all the stuff that I try to teach y'all. And if you really want to end this obesity issue, you're going to have to sit down and just do the fucking work, right? And I'm here to deliver that message and information to you. All right. Thank you guys for watching. I'll talk to you next time. Real quick, I promised you at the beginning I was going to show you how to get that weight regain course for free. So what you're going to do, go to www.weightregaincourse.com. This is 26 professionally shot videos. Okay? I brought in a camera crew. We shot it, edited it down. It's really fantastic. 26 videos. It covers every surgery. So yes, it even covers the bypass, sleeve, you name it. It covers a DS, minigastric bypass. It's good for pre-op. It's good for post-op. So pre-op, it talks about what you do so you don't regain the weight. Don't ever get into that situation. There are downloads. There are quizzes. There's an action plan. That's what I really like it. Action plan, okay? So this is one of my premium courses. This is, if you go to the website, it's $897 right now. So it's $897, which I know is a lot. I'm going to show you how to get it for free. So who wants it for free? I'll show you how to do it for free. Put free in the comment sections. I'll show you how to do it for free real quick. All right, because this is going to go away. All right? So I know this is a big chunk for people. I'm discounting it for $297 right now. So right now you can do a one-time payment, $297. Dr. Vuong, that's not free. I know it's not free. $297 is a lot of money for some people. So what I'm doing right here is I'm going to give you $99 a month times 3 months. Now everybody has access to $99, right? Because you're about to spend a lot of that on your daughter's prom dress and parties and graduation stuff. You'd spend $99 on a nice pair of shoes or a nice dinner or date, but you won't do it on yourself. And this is the problem, right? So $99, you can get it for 3 months. Now, how do we get it for free? So one of the things that I'm doing is I'm going to give you a 30-day money-back guarantee. Now, let's see who's paying attention. How many videos a day does Dr. Vuong watch on YouTube? How many videos a day? I just said it. I watch 10 YouTube videos a day, listening to my headphones, that sort of stuff, early in the morning, late at night, while I'm driving my car. I do 10 YouTube videos a day. How many videos are in the weight regain course? 26. Now, who thinks they can watch one video a day? Put me if you think you can watch one video a day. So if you watch one video a day, you'll be done in one a day. Now, you can watch them all if you want. They're all there for you. You can watch them all as you want. But if you watch one a day, that's 26 days. You'll be done with the course. You'll know what to do about your weight regain. But what did Dr. V just say? you have a 30-day guarantee. Money back guarantee, no questions asked. You can, Dr. Vuong, I watched all the videos, I don't like it, or I just want my money back. No questions asked. I won't be bothering you. I won't be whining. Why? I'll be like, that's fine. I get it. And I will give you a refund for your $99. And then that's it. You're done. So it's really zero cost to you. Now, luckily, no one's asked me for the refund. No one's asked me for a refund, so I'm super excited. That means the course is really good. Now, why am I telling you this now? Next month or next time I make this offer again, you're going to lose the $99. This time, if you sign up right now tonight and you say, Dr. Vuong, I want my money back, refund $99 back, you'll get your $99 back before 30 days, so no cost to you. That's the best I can do. I can't do better than free. Now, some of you guys are worried about weight regain, but you won't invest for free in yourself. And I've been kind of shocked. I've been doing this free offer for the last 3 weeks. I've only had a handful of people take me up on this. I'm quite surprised. So I would strongly suggest you take me up on this offer, because the next time you see it, you're not getting your $99 back. And I think that's part of the problem. I think people are assuming that there's something wrong with the course. I'm not going to honor it's too good to be true. I'm not going to honor my commitments. Trust me. Sign up tonight, $99, 30-day money-back guarantee. You get your money back. If you pass that, now it's going to be for 3 months, okay? Once you pass the 30-day guarantee, it's going to be gone for 3 months. Okay? That's it. That's how you get it for free.